Hi, everybody, and welcome to this discussion about, yes, you already saw it in the title, axillary artery. Now we are getting on in the real gross anatomy of the upper limb. Up till now, up to this point of discussion, if we have to see the chronology in which I have kind of uploaded the discussions, we have first dealt with the osteology section of the upper limb, right? Now we'll be getting on with the real gross anatomy, starting with the probably the most important, or rather the only source of blood in the upper limb, that is the axillary artery. So for understanding the axillary artery, as you can already see, we have two diagrams here. All right, so we are not going to focus on this diagram right now. We're going to focus on this diagram for the time being. So let's start the discussion. So what is the axillary artery? Obviously it is an artery, as you can already kind of observe. But what really is happening? If you're completely new to upper limb, since upper limb is the first topic that is taught in MBBS anatomy, in most, at least I was taught that. In our discussions, I was taught by my professors upper limb first, and then the rest of the domains of anatomy. So upper limb for the most part is the first domain of anatomy to be explored, and hence many of the more interconnecting things, they are missing. So we'll go very slow for the axillary artery and kind of understand what is happening. So listen very carefully. See, we have something called the heart, right? Suppose this is the heart. Okay, I know this is a schematic diagram. So from the heart, we know that there is something called aorta, right? With an arch. So the arch of aorta, the ascending aorta, arch of aorta, and then there is the descending aorta, right? So what happens is, although this is something that we'll be discovering, or rather discussing very thoroughly when we talk about heart anatomy, thorax blood supply and all of that, but just to give you a very small overview of what is actually happening and how axillary artery is coming into existence, which is, by the way, the major blood supply for the upper limb. The arch of aorta, it has three branches. It gives off three branches. We are not going into the details, but one of those branches is known as the brachiocephalic trunk. Another one of those branches is known as the left subclavian artery, and there is the middle one is known as the common carotid artery. That is not something that is really relevant to our discussion, so we are not going to even name it. But these two arteries, the brachiocephalic artery or the brachiocephalic trunk and the left subclavian artery, these are important for our discussion. You see, brachiocephalic artery will later go on to divide into two more arteries. Okay, one of them being the right subclavian artery, and the other one being, actually, if you want to know, the right common carotid artery. This one is the left common carotid artery. Anyways, see, if it is getting complicated, do not worry. All we are really interested in is the subclavian artery. So what happens is, there is a right subclavian artery which has this as its origin, the brachiocephalic trunk, and there is a left subclavian artery which arises directly from the arch of aorta. Okay, why am I telling you about subclavian artery when our topic of discussion is axillary artery? The reason is, subclavian artery continues in the upper limb or in the axilla region as the axillary artery. What do I mean by that? See, do you see this diagram over here? Let's label it. So this over here, this bone, this is the first rib. Okay, this is the first rib. Why do we have the first rib over here? Okay, first let us complete the labeling. This artery, which is coming from the superior direction over here and crossing the first rib, this artery initially, this is the, I've already kind of tried to label it. This is the subclavian artery. Subclavian artery. Both, this can be in the right as well, this can be in the left as well. So both right and left, same story. The right or left subclavian artery, when it crosses the outer border of the first rib, after that, the continuation of the same subclavian artery, it is not known as subclavian artery anymore. It is known as, you guessed it correctly, yes, the axillary artery. So that is why, for really understanding the axillary artery, we at least need to know a little context as to what the subclavian artery is. So when the subclavian artery, it is the same artery, you see, same artery. It's not as if the axillary artery is a branch of subclavian artery, remember. Subclavian artery's continuation is the axillary artery, not branch. Okay? From where exactly are we saying that this is the axillary artery? From the outer border of the first rib onwards, we are saying it is the axillary artery. Okay? So this is just to like really introduce you to this axillary artery. Later on, this axillary artery will continue on from the, this is, you know, the axillar region for all intents and purposes. Later on, when it will continue on to the arm region, from a certain point onwards, which we'll discuss right now, it will be known as the brachial artery. Okay? But, okay, systematically, we'll come to that. So, what exactly is happening to the axillary artery? You see, I have also drawn these two muscles over here. This is a muscle arising from a bone over here. This bone or bony process, this is the coracoid process. Coracoid process. So what is happening? From the coracoid process, a certain muscle is arising and going down like this. Okay? Why have I drawn this muscle? What muscle is this? Yes, this muscle that I've tried to draw here, this is the Pectoralis Minor muscle. The Pectoralis Minor. So the question arises as to why have I drawn this Pectoralis Minor? Why suddenly this muscle? The reason for that is, you see, Pectoralis Minor is crossing the axillary artery in such a way that there is a part of the artery which is proximal to it, that is lying before the Pectoralis Minor, before the intervention of the Pectoralis Minor, there is a part of the axillary artery. There is a part of the axillary artery which is directly behind the Pectoralis Minor, and there is also a part of the axillary artery which is beyond the Pectoralis Minor. Based on this, the axillary artery is divided into three parts. The part before the Pectoralis Minor intervention is known as the first part, number 1, as written over here. The part directly behind the Pectoralis Minor, the part of the axillary artery directly behind the cover of the Pectoralis Minor, that part is the second part of the axillary artery. Whereas the part after that, beyond that of the axillary artery, that is the third part of axillary artery. Now, question. Where exactly does the axillary artery end? And how does it end? That is where this next muscle comes into play that I have labeled over here. This muscle, ladies and gentlemen, is the teres major muscle. Very interestingly, just like the axillary artery was a continuation of another artery, which is subclavian artery, axillary artery itself, beyond the lower border of teres major, continues as another artery. which is the brachial artery, which I was talking about just a minute ago. The brachial artery. So do you get a complete picture over here? What's actually happening or what's going to happen? Subclavian artery was coming, it crossed the first rib superiorly. Outer border of first rib onwards, the name of the subclavian artery was changed to axillary artery. Why? Because this is the axillary region, that's why. It is the same trunk continuing all throughout. Later we will come to know that it is only in the roughly speaking elbow region where this artery will divide into the radial and ulnar branches, but up till then the entire arm, axilla region, neck region is the same artery, only with different names at different regions. Subclavian artery, from outer border of first rib onwards, axillary artery, then teres major lower border onwards, brachial artery, because now you have officially entered the domain of brachium or arm. That's why brachial artery. So the names are pretty obvious and they are named according to the location. Okay, so that's how you deal with this. Now an interesting thing, actually later on this will sometimes arise as a problem, or this used to actually be a problem for me. I used to get confused as to Pectoralis minor or teres major, which one is which one. So I used to be like, was it Pectoralis minor which causes the division of the axillary artery into its three parts, or was it teres major? How do you clear that confusion? How do you actually remember that it is the Pectoralis minor which is doing this and it is the teres major which is causing brachial artery continuation? How do you actually remember these two muscles? For this there is no mnemonic, okay, so don't get your hopes high. What you need is sound anatomical knowledge. What do I mean by that? See, which one is superior, Pectoralis minor or teres major? How do you remember that? You remember that by remembering the origin or insertion, origin insertion, or their attachments. I remember for a fact that Pectoralis minor, it arises from the coracoid process. From here Pectoralis minor arises, whereas in that same scapula later on, this is the lateral border of the scapula, from the lower part teres major will come out. This is something that we have already talked about when we talked about scapula, right? So obviously Pectoralis minor should be the superior of the two muscles. So Pectoralis minor, being the superior of the two muscles, should intervene or meet the axillary artery first. So if it is meeting the artery first, what is the first thing that should happen to axillary artery? Its division, then it will continue as the brachial artery. So Pectoralis minor is the muscle which causes the division, and teres major is the muscle which demarcates the lower boundary or lower border of the axillary artery. Do not confuse teres major with teres minor. Teres minor has absolutely nothing to do here. Do you know why? Or do you know how you remember that? Again, no mnemonic, sound anatomical knowledge. Teres major, if you remember its attachments, it used to arise from the lateral border dorsal aspect, obviously, of the scapula. And then it used to come forwards and get inserted onto the humerus, very roughly speaking, the humerus, right? The medial lip of the intertubercular sulcus, whatever. Teres minor, on the other hand, it does not come anteriorly. It gets inserted onto the posterior aspect of the humerus itself. That's why it's one of the muscles of the rotator cuff. So teres minor has nothing to do in the anterior aspect, and this, by the way, we are having an anterior look. Obviously, this is not a posterior look, this is an anterior look. So teres major has everything to do here, teres minor has nothing to do here. Why am I wasting so much time talking about these things? These are things that nobody will tell. I mean, I'm not flexing here, but this is what I have felt, that nobody will talk to you like this. Nobody will say that this is how you do this is how you remember this is how you do not confuse these. Everybody takes for granted that you memorize them, but memorizing will only get you so far, right? This is how you assimilate, okay? So this is at least how I assimilated. So this gives us a fair idea of what the axillary artery is and how its divisions are. Remember, the first, second and third division of axillary artery is very important. Why? Because all the branches of the axillary artery, all the relations of axillary artery, they are all dealt with in the division part. That is, we will study individually as to what the first part branches are, second part are, third part are, relations of the first part are, second part are, third part are. That is how detailed the divisions are, and that is how important they are. So now, without wasting any more time, let's get on to the main bulk. That is, let's talk about the branches of the axillary artery, or rather the branches of the different parts or divisions of the axillary artery, one by one. So discussing about the branches of the axillary artery is where this diagram comes in handy. Look very carefully. I mean, obviously there are a lot of branches, but you need not worry. They are pretty simple to understand. First of all, let us label down a few of the very obvious things. I mean, this is the sternum, obviously. No problem in that, right? And these are the ribs. Among the ribs, we are very interested in this rib, which is the first rib. So this is the first rib. We are very interested in this one because obviously, for obvious reasons. This bone over here, which is cut, can you see? This is the proximal part, this is the distal part of the bone. The intervening part has been cut so that we can get a better look at the axillary artery. This is the clavicle. The clavicle. So this is the acromion process over here. So let's quickly diagram that, or rather label that as well. This is the acromion. Okay, it has gone out of frame. Okay, now. So now let's get on with the real deal. As you can see, this is obviously the subclavian artery. Why this is the subclavian artery? Because outer border of first rib we have not yet reached. This muscle that is, by the way, arising from this first rib superior border, which is also sometimes demarcated as just like we said that the outer border of first rib is the demarcating point for beginning or initiation of the axillary artery. Sometimes we also say that this muscle marks the initiation of axillary artery. This is the serratus anterior muscle. Okay, serratus anterior. Anyways, just to give you, an anatomical overview. First part of the axillary artery. Now, before we get on, there is a very interesting thing which nature has played here, and that has made our medical students' job much easier. You know what that thing is? Very interestingly enough, these parts of the axillary artery, they give the number of branches that they each give is corresponding to the number of the part itself. What I mean by that is the first part has only one branch, second part has two branches, and third part has three branches. Like, how much more convenience do you need than that, right? So that is very convenient for us. First part gives only one branch. As you can see, I have labeled, or rather I have drawn it over here. This artery, this is the superior thoracic artery. It is actually a small branch. It is not it's not big or anything. It's a small branch. So let's label this. This is the superior thoracic artery. So as you can see, I mean, you are more than equipped to just know the name of the branches. But just for the sake of a little bit more knowledge, we can give a little bit of description about all these arteries. But for the most part, if you're not okay with it, just know the name of the branches. Okay? Anyways, a little description about the superior thoracic artery. As I just now mentioned, thoracic. So obviously it has something to do with the thorax. And as I just mentioned, first part branch, very small branch. First part of the axillary artery, right? And as the diagram is suggesting, it is running downwards and a little medially as well. It is running downwards and a little medially as well. What does it supply? As its name suggests, it supplies the thoracic region. To be a little bit more precise, it is actually supplying the thoracic wall. Now tell me something. What are the two most important muscles of the pectoral region or the thoracic region? I already named it pectoral. So yes, Pectoralis Major and Pectoralis Minor. And guess what? Superior thoracic artery, it ends by supplying both the Pectoralis Major and Pectoralis Minor. So as its name suggests, thoracic, it ends by supplying the thoracic wall muscles, which is the Pectoralis Major and Minor. That is the only branch of the first part. So pretty simple. Done. Second part. Okay, now second part has two branches. One of those branches is this thick. I've made it thick intentionally because this thick branch itself has again 4 sub branches. But don't worry or don't get paranoid about this. The branches are very simple. Okay, first let us name the actual branch. See, this thick branch, which is actually arising from the second part, this is actually labeled as the thoracoacromial artery or the acromiothoracic artery. If you name it acromiothoracic, there is a slight advantage that you have. See, superior thoracic, acromiothoracic. And later on, another branch from the second artery, second part will be the lateral thoracic. So all of them will have suffix as thoracic. If you remember this as acromiothoracic, then this will be an advantage for you. How? Superior thoracic, first part, acromiothoracic and lateral thoracic, second part. We haven't yet talked about the lateral thoracic. First, let's talk about the acromiothoracic or thoracoacromial artery. See, this thick thoracoacromial artery, it is emerging at a very important point from the second part. It actually emerges from the upper end or rather upper margin of the pectoralis minor muscle. Another very important thing about this thoracoacromial artery is that this is one of the structures which pierces the clavipectoral fascia. Very, very important. When we move on to the model section, like later on we'll talk about, when we talk about the relations and all of that, we will talk about the clavipectoral fascia, although we won't talk about it in details. It's a separate topic altogether. There we will see that there are a number of structures which pierce the clavipectoral fascia. Very important to know. One of those structures is the thoracoacromial or acromiothoracic artery. Acromiothoracic artery has 4 terminal branches. 4 terminal branches. What are they? One branch, as you can see, it is coming down like this. This is the pectoral branch. The pectoral branch. This is also known as the breast branch. In case of females, these are large and they are known as the breast branches. So obviously pectoral, so again they will supply the pectoral regions or the pectoralis major and minor muscles, and the breast in case of females, right? That's the pectoral branch. Second branch, as you can see, which one should we cover? Okay, let's go for this one. See, this one is going slightly towards the acromial process. So obviously the name given to it is the acromial branch. Is it okay? It's not visible. Over here it is. The acromial branch. Okay. So as its name suggests, again, the acromial branch, this is actually going towards the acromial process, And later on we will see that there when we talk about the scapular anastomosis and the scapular region blood supply, we will talk about an anastomosis that is located in the acromial region. So this acromial branch is actually a constituent of that anastomosis, but right now that's not really our point of discussion. So for all intents and purposes, that is the acromial branch. Next, there is another branch, this one is moving towards the clavicle. So this is the clavicular branch, the clavicular, is it, yeah, okay, it's visible, the clavicular branch. Again, it's moving towards the clavicle, so that actually is self-explanatory. One extra information that you might actually remember about the clavicular branch, again up to you. If you don't want to complicate it, don't go for it. Clavicular branch is actually one of the branches which supplies the subclavius muscle. Okay, there is a muscle over here, subclavius, very important a muscle. We'll talk about it later in later discussions. This actually supplies the subclavius muscle and also the acromioclavicular joint. Okay, the acromioclavicular joint supplied by the clavicular branch. May or may not you really remember. These are really low yield information. I don't think these are pretty high yield information, pretty low yield information. The last branch of the thoracoacromial artery, which is itself a second branch, or rather second part branch, this branch. This is somewhat going towards a very extensive muscle which crosses, or rather is located over in this region. What muscle is located in this region? Very extensive. Yes, the deltoid. So this over here, this, my friends, is the deltoid branch. Is it visible? Yes, the deltoid branch. Okay, deltoid branch, this again has one high yield information regarding it. What is that? Deltoid branch runs in a groove when it see, it's going from the thoracoacromial artery, it's going like this. So when it is going like this towards the deltoid region, it is traversing a groove which is present in between the deltoid and the pectoralis. So pectoralis is somewhat, Pectoralis Major I mean, Pectoralis Major is somewhat like this, and the deltoid is somewhat like this over here. So in between the deltoid, which is like this, and the Pectoralis Major, which is like this, there is a groove present, which is known as the deltopectoral groove. Very important landmark. In dissection, it is pretty well explained actually. And there are a number of structures which actually cross, or rather traverse, the deltopectoral groove. One of them is the deltoid branch of the thoracoacromial artery. Okay? Okay. So this completes all the sub branches of the thoracoacromial artery. Now, why did I say in the beginning that this is pretty easy to remember, these four branches? If you take the first letters of all these four branches, this A, this is P or B. See, pectoral branch or breast branch. Right. So if you take A, B, clavicular C, deltoid D. So such a good mnemonic you have over here. A, B, C, D. Acromial, breast branch or pectoral branch, clavicular branch, deltoid branch. So how simple it is, right? That's why it's easier to remember in this way. The last branch of the second part of the axillary artery, that is this one, going laterally and downwards like this. This is actually just like the thoracoacromial artery was emerging at the upper border of the Pectoralis Minor. This branch of the second part emerges at the lower border of the Pectoralis Major. This is known as, this second part branch, this is known as lateral thoracic artery. Lateral thoracic artery. It is going downwards, and obviously since it is lateral, this is the medial side and obviously this is the lateral side, so lateral thoracic artery. Okay, when we'll talk about the breast anatomy, when we'll talk about the breast blood supply, then we will know the lateral thoracic artery is a very important artery in females, because when it is going down, it will give lateral mammary branches or lateral breast branches to the breast. So it is a very important as far as the breast blood supply is concerned. So that is one high yield information which will come in handy later. Okay. Now, third part of axillary artery. What exactly does the third part of axillary artery have to offer? Well, the third part of axillary artery is interesting again because it has three branches. As I've already mentioned, it has three branches. What are those three branches? Let's talk about them. First branch, let's talk about this branch, which is winding around the humerus anteriorly, like this. This branch over here, this is known as the anterior circumflex humeral artery. Anterior circumflex humeral artery. So see, if you remember, when we had talked about humerus anatomy, we had said that there is a bicipital groove over here in this region, right? In the bicipital groove, we had said that the tendon of biceps brachii along with the synovial sheath that actually crosses downwards. It's a passage for the biceps tendon. That's why bicipital groove. But we had also mentioned that there is an artery which traverses that. That artery is this artery, the ascending branch of the anterior circumflex humeral artery. Okay? Anterior circumflex humeral artery, that is giving up an ascending branch like this, and this will actually move on in the bicipital groove. Okay, later on this will actually I have cut it short. This will move on, and then it will actually supply the head of the humerus along with the shoulder joint itself. Anyways, beyond our discussion, anterior circumflex humeral artery, by the way, itself it ends or terminates by anastomosing with its counterpart from the posterior side, which brings us to the second branch of the third part of axillary artery, which is this thick branch that I have drawn over here. This is the posterior circumflex humeral artery. So posterior circumflex humeral artery. Okay, so posterior circumflex humeral artery, just like its anterior counterpart, winds around. That's why the name is circumflex. Circumflex means winding around. So posterior circumflex humeral artery will wind around, although posteriorly around the humerus, and again, as I had just mentioned, it will actually anastomose with the anterior circumflex humeral artery, forming what we say to be an anastomotic circle around the surgical neck of the humerus, which we also had talked about in the humerus anatomy. Okay, in the humerus anatomy we had said that the surgical neck of the humerus, it's pretty important. Why? Because of the presence of this anastomotic circle, along with the the axillary nerve also winds around it. So anyways, this is one of the reasons why the axillary, or rather why the surgical neck is important. This anastomotic circle between anterior and posterior circumflex humeral artery, that is actually present in the surgical neck, although it is depicted in this diagram. I have depicted it a little lower. It should be a little higher. I apologize for that. But anyways, this is how it is. Later on, when we will talk about the scapular region and the muscles of the scapular region, we will talk about a few intermuscular spaces. There are actually a few intermuscular spaces. Right now I'm not going into the details of that, we'll talk about it later. But posterior circumflex humeral artery, that actually passes through the quadrangular intermuscular space. Okay. Do not worry if you do not understand, or if you are hearing this for the first time. Don't worry, you don't have to remember it right now. When we'll talk about the intermuscular spaces later in our later discussion, then it will be very easier to understand. By the way, I have not yet completed. See, the posterior circumflex humeral artery, it is giving this ascending branch over here, this ascending branch, and this descending branch over here, right? This ascending branch, again we'll talk about it when we talk about the anastomotic region in the shoulder joint, or in the scapular region, or the scapular anastomosis. This descending branch, on the other hand, this also we will talk about later, because this will actually anastomose with the ascending branch of the profunda brachii artery. Again, when we talk about arm anatomy, when we talk about, there we will talk about this. So right now our scope is a little limited. That's what I'm trying to point out. Do not worry. That completes the anterior and posterior circumflex humeral artery. The last artery branch of the entire axillary artery, which is also a branch from the third part, it is this, going downwards. This is the largest branch of the axillary artery. This, my friends, this is the subscapular artery. Subscapular artery. This is the largest branch of the axillary artery. Very important information. Subscapular artery, again better discussed in the scapular anastomosis region, but for now all you can remember is it is the largest branch, and it is kind of, it actually runs around the lower border of the subscapularis muscle, right? And it terminates, if you can see, this is the scapula, and this is the inferior angle of the scapula. So it actually terminates in the inferior angle of the scapula itself, right? Not much to say over here. And supplies the latissimus dorsi and serratus anterior muscle. It gives a very important branch, which is, later we'll talk about it, the circumflex scapular branch, which I have actually drawn over here. This branch, this is the circumflex scapular branch. This is the circumflex scapular. Again, scope is limited, so we'll not talk about this. But in the scapular anastomosis, all of these will be a lot clearer. Okay. So that more or less actually completes the axillary artery branches, the axillary artery itself. Now, the rest of the section will be dedicated to the relations of the axillary artery, which are very important as well. So let's deal with that. We are in a position to discuss about the relations of the axillary artery. As you can see, this pink colored highlighted structure, this is the axillary artery. Don't worry, we'll get a closer look at that. Why I have such a panned out view over here is to really give you an overview as to how the relations would probably look like, what the muscles all around are, and as you can see, I have removed the pectoralis major over on the right side, whereas on the left side we have the pectoralis major. Why I have done that is to compare both sides, or rather compare the superficial relations. Obviously both sides relations would be the same, but compare and contrast really. So let's get started. So how we are going to deal with this, let me first give you an overview. Firstly, we'll talk about the different parts themselves and their relations. Okay, general relations like muscle relations, any veins or any other fascia, anything like that. Then specifically we will talk about the relation of the axillary artery with the brachial plexus. Now, if you do not know about the brachial plexus, although I would suggest that you get a little knowledge about the brachial plexus before you delve into the relations of the axillary artery with the brachial plexus, or you can skip the brachial plexus relations for now and only concentrate on the other relations. However, if you are a little bit adept with the brachial plexus, just know your thing around, although I would give you a bit of an overview, don't worry. Then I would say that you would be in a position to really understand the relations of the brachial plexus with the axillary artery. So that is a section that we'll be concentrating on after we have finished the general relations of the axillary artery. So without further ado, let's really start. So the first part of the axillary artery, as you can see, first of all, this is the pectoralis minor muscle. Okay. So this part is the third part of the axillary artery, the part which is behind second part, and this part, this is the first part of the axillary artery. Now, first part of the axillary artery. What are the anterior relations for that? See, anterior relations for almost all the parts of the axillary artery, they remain for the most part the same. Because obviously anteriorly throughout you will have skin, you will have the superficial fascia for the pectoral and the upper limb region. You will also have the deep fascia, which in case of the really pectoral region, it is the pectoral fascia. The pectoral fascia, which is the fascia covering the pectoralis major, that constitutes for the deep fascia of this region. Anyway, so superficial fascia, deep fascia, pectoralis major itself again will be a superficial relation, or rather an anterior relation. Why? Because as you can see, this is a pectoralis major. So if the pectoralis major had been present, you would not have been able to see the axillary artery. That's why I have removed it. But obviously you can understand why it is the anterior relation, obviously. So these are more or less the general relations which will always be like constant for all the parts. Now let's get on with a little specific things for the first part. So look very carefully. Let's first start with the muscle over here, this muscle. This is known as the platysma muscle. And as you can see, this platysma muscle, this will constitute for first part of axillary arteries anterior relation. Why you can understand this? Obviously from the model, right? Platysma, again, if you do not know about it, no problem. It is a constituent of the, or rather it is an example of panniculus carnosus, which is superficial or skin or cutaneous muscles which have attachments to the skin, which are few in the human body but are plentiful in other mammals. So platysma is something that we'll talk about in the neck anatomy region, or I think we've already talked about it. Yeah, I have discussed it on my channel already. But anyways, if you are new to anatomy, upper limb is the first domain, then no problem. You will talk about, you will learn about it later. So that's the first part of axillary arteries anterior relation, platysma. Now, I talked about the pectoralis major, right? Pectoralis major has two parts. One part is the clavicular part. The other part is the sternocostal part or the sternal part. Obviously, as the name suggests, sternal part originating from the sternum, the manubrium sterni, actually the oblique aponeurosis of the external obliques as well. So it has a very extensive origin and it is larger of the two parts. Clavicular part, obviously as the name suggests again, originates from the clavicle. Anterior aspect of the medial half of the clavicle, we know that. It is the clavicular part which is the anterior relation for the first part of axillary artery. And again, it is pretty self-explanatory because see, this is the clavicle over here. Faintly you can see it. So clavicular part will be the anterior relation for the first part of axillary artery. Now, remember I was talking about a fascia, the clavipectoral fascia, Remember that? Fascia, fascia, whatever. So this clavipectoral fascia, this will also actually encapsulate the pectoralis minor muscle along with the subclavius muscle and will be an anterior relation for the first part of the axillary artery. So this over here is the pectoral fascia, which I was talking about, the deep fascia of the chest region. The pectoralis major is covered by this pectoral fascia. If I hide this, we come on to another fascia, which is the clavipectoral fascia. Clavipectoral fascia is it's a small topic, but it's pretty important actually. So it actually encapsulates, as you can see, the pectoralis minor, and it is also, when we'll talk about the axilla, we will know this. An extension of the clavipectoral fascia is known as the suspensory ligament of axilla. So it actually holds the posterior wall of the axilla. Again, not a problem right now. So what I'm only trying to say here is that, as you can see, this should be one of the anterior relations for the first part of axillary artery. Over here it has been cut. No, okay, here. Okay. No, it's okay. It's okay. So this is one of the anterior relations. Okay. Okay. Now, I'll show you, or rather I had talked about a few structures which pierce the clavipectoral fascia. Remember? These structures which pierce the clavipectoral fascia, we can already see one of them, the thoracoacromial artery over here. Okay, this over here. See, thoracoacromial artery, it is piercing the clavipectoral fascia. But there are a few other structures as well. For that, we will see a diagram. See, this over here is the clavipectoral fascia. This is a very, very good diagram from Netter's Atlas. So, the thoracoacromial artery piercing the clavipectoral fascia. In the same region, there is another vein which pierces the clavipectoral fascia and enters deep. This is known as a cephalic vein. This will be a topic of discussion, separate topic of discussion. Cephalic vein is also one of the structures which pierces the clavipectoral fascia. Another structure over here, it actually has been shown in this yellow. This is one of the nerves actually. This nerve which pierces the clavipectoral fascia, this is the lateral pectoral nerve. Okay, the lateral pectoral nerve, this also pierces the clavipectoral fascia to come out and actually supply the pectoralis major and minor. Brachial Plexus branch, talk about it later. So why I showed you this diagram of why I'm talking about structures which pierce the clavipectoral fascia is because these structures which pierce the clavipectoral fascia are all piercing them, or rather piercing the fascia at a common point somewhat. And this common point is anterior to the first part of axillary artery. So all these structures that I just now talked about, they are anterior relation for the first part of axillary artery, along with the clavipectoral fascia itself. Okay, so that completes the anterior relation. Now, what about the posterior relations for the first part? See, as you can see over here, the first part is actually crossing the ribs, and within the ribs there is, obviously we know, a muscle called the external intercostal. So very specifically speaking, the posterior relation for the first part of axillary artery will be the first intercostal space along with the external intercostal muscle. Although in this model it has been shown to be both first and second intercostal spaces, but in the textbooks I have seen it written that it is a first intercostal space with the external intercostal muscle only. So actually it might vary a little bit, I guess, or this model might be wrong. Anyways, all we need to understand is that first or the first two intercostal spaces along with the external intercostal muscle, that is a posterior relation. Along with that, there is another very important muscle over here. As you can see, if I highlight, this over here is the Serratus Anterior muscle. Very, very important. The serratus anterior muscle, it actually originates via digitations, right? We know this. So the first two digitations, they actually constitute for, this is the axillary artery's first part. First two digitations, they are the posterior relation for the axillary artery's first part. Okay. So that is the general relations. Now there is actually another relation, but that is a brachial plexus relation. So we'll talk about it in a little time. Wait, let's first finish this part and then we'll talk about it. Then there is a lateral relation as well, but again lateral relation is for brachial plexus, so we'll leave it for now. We'll come back to it in a bit. Medial relation. Now medial relation, for that we need the vein, because throughout the entire extent of the axillary artery, the axillary vein will be always a constant medial relation. Very, very important. In fact, the first part of the axillary artery, it is actually encapsulated with the axillary vein and the brachial plexus. These three structures, the axillary vessels and the brachial plexus together, in the first part at least, they are encapsulated in a common sheath known as the axillary sheath, which actually is a derivative of the prevertebral layer of the deep cervical fascia, which we'll talk about in the neck anatomy region. So that is a medial relation, and that more or less completes the first part. Second part, let's move on to the second part. Again, second part, medial relation, obviously axillary vein. There is, or rather there are other relations, medial relations for the second part as well. Let's remove the Pectoralis Minor so that we get a better look at the second part. So this is the second part, right? So again, brachial plexus is very well related to the second part as well, but we are ignoring that for now. Medial relation, again axillary vein, no problem with that. What about the anterior relation? Anterior relation, again the same things: skin, superficial fascia, deep fascia, pectoralis major, and in this case pectoralis minor as well, obviously, right? What about the posterior relation? Again, posterior relation, we have brachial plexus, but there is a muscle which is related posteriorly as well. If you see, this is the muscle that I'm talking about. This is the subscapularis muscle. The subscapularis, when we'll talk about the axilla, we will come to know that the subscapularis, along with along with other two muscles, which we will come to know in the third part of axillary artery relations, these three muscles will actually constitute the posterior wall of the axilla. So it makes sense that they are the posterior relations for the second and third part of the axillary artery. Okay, but for the second part, only the subscapularis. The other two muscles, which is, let's break the suspense over here. This muscle, that is teres major, and this muscle, that is latissimus dorsi. These three muscles, subscapularis, teres major, and latissimus dorsi, these are the three muscles from the superior to inferior aspect. They are the posterior wall of axilla, but superiorly, second part of axilla, only subscapularis is related posteriorly. When we'll talk about the third part of axilla, in the first part there will be subscapularis, and in the lower part there will be these two muscles. So the third part of the axillary artery will be related to all the three muscles of the posterior wall of axilla. I hope I am making sense over here. Alright, I hope this makes sense. Anyways, that's a posterior relation for the second part. What about lateral relation? Lateral relation, again there is brachial plexus, but along with that there is this muscle. This is the Coracobrachialis muscle right here. Coracobrachialis itself is not visible really, but I have removed the biceps from here, the biceps brachii, and the short head of the biceps brachii, that actually really hides the coracobrachialis. I have removed them, so the coracobrachialis is pretty visible. And as you can see, this is the second part, and this side is the lateral side, right? This side is the lateral side, this side is the medial side. So the lateral relation is a coracobrachialis. That completes the second part as well. Third part of axillary artery. So which part would be the third part? See how you can know this even without uh, bringing out the pectoralis minor. See, I can see that this is a branch coming off from over here. So this must be the lateral thoracic artery. See, and what I had mentioned is that the lateral thoracic artery comes out from the lower border of the pectoralis minor. So this must be the ending for the second part, and this must be the third part over here. So now we are in a position to really talk about the third part, this entire part. So if I remove the coracobrachialis, we'll have an even better view. This entire thing is the third part until this is the teres major, right? So from the lower border of teres major onwards, this becomes the brachial artery. Okay, so this is the third part, the last part of the axillary artery. So again, the anterior relations, not really much to talk about. Skin, superficial fascia, the deep fascia. Again, there will be the pectoralis major, because pectoralis major is a pretty extensive one, right? But in the anterior relation of the third part, we have a nerve as well, which we'll talk about in the brachial plexus section. Okay. Now, third part of axillary artery, a very interesting thing about that is it is intimately related with brachial plexus. So there is not much to talk about as far as general relations are concerned. Again, the posterior relation I already talked about. In the first part, there is subscapularis. In the later section, there is teres major with latissimus dorsi. This is teres major and this is latissimus dorsi. Okay, and this is subscapularis. The lower part of the subscapularis in the upper section of the third part of axillary artery will be related posteriorly, and these two muscles, they will also be related posteriorly to the third part. Okay. Now we move on to the lateral. So I just now removed the coracobrachialis. So the coracobrachialis, that is actually a lateral relation, just like the second part of axillary artery. I hope I don't have to bring it back to show you. Pretty self-explanatory, right? That is more or less the relation, general relation of the third part of the axillary artery. Now, without further ado, I hope you understood all the muscles and all the vein and all the fascia and all of that. I hope the general relations are clear to you. Now, finally, we will move on to the brachial plexus relations. For that, I need this diagram. I could not explain the brachial plexus relations in the model itself. The reason for that is that it's not really very accurate in the model. But this diagram from BD Chaurasia, I think it's pretty simple and it's pretty easy to understand, at least for the beginner section. People who don't really have adept knowledge about the brachial plexus, for them it's pretty self-explanatory. Now we finally have the brachial plexus relation. So now let's start from the first part again. And don't worry, it's pretty simple. So now listen to me very carefully. If you don't know really about the brachial plexus, first you need a little knowledge about that. But I hope you know a little bit about the brachial plexus to know that brachial plexus has a medial cord, a lateral cord, and a posterior cord. Okay, I hope you know this. And later on, these cords, they will divide to give branches. The branches are the real nerves. So the real thing to actually know here, again, there is not much to memorize, but there is a lot to know anatomically. First part and the second part. Second part is a heaven, by the way. For brachial plexus relation, second part is the easiest. I'll tell you why in a bit. First part and second part, they are related to the cords of the brachial plexus. Whereas the third part of the axillary artery, that is actually related to the branches of the brachial plexus. The first part, okay, how I remember the brachial plexus, how I personally remember the brachial plexus relations for the first part. Again, you can just memorize. Before the day of the examination, you can just memorize and go and you'll be fine. But how well can you assimilate? That's all that I'm really trying to go for here. How you actually imbibe this knowledge is, I remember only one thing about the brachial plexus relation. For the first part of the axillary artery, I try to think that the brachial plexus is a little superiorly or a little laterally shifted. I remember only this. By remembering only this one fact, that the brachial plexus for the first part is a little laterally shifted, I can say that the medial chord, which would otherwise have been a medial relation, becomes a posterior relation. Whereas the posterior chord, which otherwise would have been a posterior relation, becomes a lateral relation. Whereas the lateral chord, which otherwise would have been a lateral relation, remains a lateral relation because you have shifted it laterally. So lateral chord relation becomes more lateral. So do you get me? Do you understand what I'm going for? Medial chord becomes a posterior relation for the first part. Why? Because we shifted the brachial plexus laterally. We shifted it laterally towards this side. So instead of being medial relation, it became the posterior relation. Instead of the posterior one being the posterior relation, it became the lateral relation, and the lateral chord, as you shifted it laterally, it remains lateral. So it is a lateral relation. So this is the relationship of the first part. Second part, now very simple. Medial chord is the medial relation, posterior chord is the posterior relation, lateral chord is the lateral relation. Do you know why this simplicity is, or rather why this simplicity actually exists? This is because the chords of the brachial plexus are named in accordance to their relations to the second part of the axillary artery. So this is pretty convenient for us. You're saying lateral chord, you're saying medial chord, posterior. Lateral to what? Medial to what? Posterior to what? The answer to that what is the second part of axillary artery. Second part of the axillary artery. Okay, so the relations are very simple for the second part. Third part. Now, finally, third part is where the chords have divided into branches. So you need a little knowledge again about the branches of the different chords. But the, just to put it very simply, the lateral chord branches more or less are the lateral relations. Posterior chord branches are more or less, the terminal branches at least, they are the posterior relations. And the medial chord branches are the more or less the medial relations. So we know that the lateral chord, it actually gives the lateral branch or the lateral root rather of the median nerve. So that is a lateral relation for the third part. It also gives the musculocutaneous nerve, which is also a lateral relation for the third part. Medial root of the median nerve. Remember, I had said that there is an anterior relation for the third part of axillary artery. That anterior relation, as far as brachial plexus is concerned, for the third part of axillary artery is the medial root of median nerve. Medial, median. The nerve is median, root is medial and lateral. Okay, do not get confused in that. What is happening here, again, anatomically you should be very sound to understand this, that the lateral chord remains, or rather the lateral root remains lateral, but the medial root of the median nerve actually crosses the third part of axillary artery to reach the lateral root and form the median nerve, which, by the way, median nerve, by the way, how is that related? That is related laterally. So the median nerve itself becomes a lateral relation for the third part of the axillary artery. medial root of the median nerve becomes an anterior relation for the third part of axillary artery, whereas posterior chord, it has two major terminal branches. The radial nerve, which is a posterior relation for the third part, and the axillary nerve. Where is the axillary nerve? Over here. Okay, I don't think they have shown it. It should be over here somewhere. I don't think they have shown it actually. Anyways, so the axillary nerve, that also is a posterior relation because it is a branch from the posterior chord over here. So posterior chord gives the radial nerve and the axillary nerve. It gives other branches as well, but these are the two terminal branches and they are the posterior relation for the third part. Brachial plexus relation I'm talking about. What about the medial relations? Obviously axillary vein would always be there, but we're interested in the brachial plexus relations. So medial chord branches, they are more or less the medial relations, except the medial root of median nerve, which is an anterior relation. Okay. So what are the branches more or less? We have the ulnar nerve over here. As you can see, this is the ulnar nerve. So this is one of the medial relations. We also have this branch, which is the medial cutaneous nerve of forearm. As you can see, the medial cutaneous nerve of forearm and the ulnar nerve. These two nerves are situated in between the axillary artery and the axillary vein. Whereas there is another branch which is the medial cutaneous nerve of arm. This branch, it is also a medial relation of the third part, but more importantly, this is actually medial to the axillary vein as well. Whereas these two, ulnar nerve and the medial cutaneous nerve of forearm, they are lateral to the ulnar, or they are lateral to the axillary vein. So these three, ulnar nerve, medial cutaneous nerve of forearm, and the medial cutaneous nerve of arm, they are more or less the medial relations for the third part of the axillary artery. So that completes the entire relations of the axillary artery. We talked about the brachial plexus relations separately. We talked about the general relations over here in this model. First, we gave a general overview of the axillary artery, its different parts, the branches of the different parts, and then the different relations and all of that. So I think we have done more than enough for this discussion, and without making this video any more longer, I guess, thank you very much, and I hope to see you soon in another discussion. Thank you.